And I think you've got to start with the notion of the frustrations that have been piled up over and over the years, justifiable frustrations from the clinical community around the need for change. It is very much a well understood fact that the pressures are unsustainable, that systems are barely coping, and by virtue of quoting some clinical leadership in the field, in some areas of the country are practically not working as intended, not failing. Now, we have a really good understanding of what needs to happen, and a lot of work has been undertaken in the past sort of 5 to 7 years to get a really good sense of what needs to change at what levels, and things like training skills and system reform and transformation are very questions have been kind of answered. Now, what is missing from the equation is a little bit of goodwill and support to implement and make that happen at scale. And that's what needs to happen now, in my view. We need to, as an area of medicine, as a sector, we need to persuade, and we need to draw attention to those, the highest echelons of power, to take stock of the realities and the opportunities as well that come with delivering support at the coalface of wound care in the NHS. I think the question, coming back to what the future looks like, it'll be highly dependent on where the needle shifts on drawing that layer of support. I think if we look at recent events as well, particularly changing government and the reports and assessments that have been made on the health service, it makes a more poignant point around the role that the leg clubs will play in the future, especially when we talk about the need to engage in more preventative care, closer to the communities, closer to patients, make those more accessible, which are all things that the leg club model delivers. So how do we engage, and how do we persuade, and how do we deliver at scale and at pace to deliver for those patients, but also for those professionals that facing these pressures? So it's going to be instrumental. It's going to be instrumental to make these things happen for the better.